MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you.
Connecting Marylanders to their government. This is State Circle.
Good evening. Welcome to State Circle. Coming up tonight, insights on the racial disparities in the coronavirus data and neighbors helping neighbors in producing face masks. But first tonight, Governor Hogan told reporters today that the state may still be far away from lifting his stay-at-home order as the number of deaths continues to accelerate, now approaching 500.
The number of cases is going to rapidly rise. That's not necessarily a bad thing. It just means we're testing a lot more people. But we're really keeping an eye on how many people are going in the hospital, how many people are moving from the hospital to an acute or intensive care bed, and then how many people we're losing to the disease. So those things, all three of those categories have to be in a downward direction for 14 straight days.
The governor's executive order requiring the wearing of face coverings takes effect at 7 a.m. Saturday. It applies when inside retail establishments or when riding public transportation. The state school superintendent today extended her order closing schools. That will now continue through May 15th. And meantime, the Washington, D.C. schools will remain closed, and the academic year there will end 3 weeks early. We spoke today with the CEO of the Prince George's County School System, Dr. Monica Goldson.
Well, we just concluded our first week of distance learning, and we're doing a blended approach. So we have online support for students. We're using our cable television station, and we're providing instructional packets. As you said, I have 136,000 students, so we're trying to get every student we can engaged in the learning process.
Now, what have those students been told? What are they supposed to be doing during their school day at this point?
So they have a modified school day. It starts at 9 a.m. and concludes at 1 p.m. We do a very specific content level every day. For secondary, they have one content level. For elementary, they have two. Today is Friday, and so today they're all participating in elective courses. So art, music, physical education, just to name a few. Teachers have prepared and received professional development prior to us unveiling our distance learning plan. And every week they get to engage with other students. Our teachers now have virtual office hours to support students who need assistance with their new way of learning or new content. And we've concluded now 4 days of learning. We were closed on Monday, and every day learning new ways to make sure we connect with students.
How about the parents? And I'm thinking that parents are in all kinds of different situations. I mean, on the one hand, you probably have some people who are former teachers. You have some people who may be able to stay at home, whether they're working or not. But some people have to go out and work, maybe in dangerous jobs. And so, what's the message for them?
Well, honestly, many of our parents became our co-teachers. Prior to us even starting distance learning, they were trying to find ways to keep their kids engaged all day, every day. What we've tried to do is to relieve some of that pressure from them by having our teachers to deliver that content from 9 to 1. So students can watch a television program, and if they're in pre-K through grade 5, they can sign in online if they were able to pick up a laptop during the 2-week distribution time period, or they can go to 43 of our meal distribution sites and pick up the instructional packets. So honest and truly, what we wanted to do was to relieve some of the pressure from our parents because they were doing just that. Some of them are essential workers and they are working every day. And we wanted to make sure that they didn't have to be present for the student to actually experience that instructional learning program.
You know, in terms of the technology, of course, you have the haves and the have-nots. You have people with great broadband and great computers. You have people with no broadband and no computer. And I know you've been helping those folks out.
Yes, honestly, we are a school district that represents 82,000 students who are on free and reduced meals. And so just the thought of moving to distance learning kept me up at night when we first started this. But I'm grateful that a lot of our employees came out, as I said, for 2 weeks in a row, and we distributed 60,000 laptops to students. We had parents who helped out and allowed their students to use technology in their home. So that was about 15,000 parents who agreed to allow their kids to work online. Comcast and Verizon have been great partners. We now are working with them to provide support to students who don't have broadband access. And so, honestly, our community has come together. We had a graduate who works for Google who donated $100,000 to close the gap for our seniors who needed to be online. So I'm grateful for everyone who's helped to close this digital divide. What this pandemic has done, though, is help to really help people to see that there is a digital divide and an inequity that exists among socioeconomic backgrounds, and it is my job to make sure I close that.
You're also an important source of meals for a lot of kids, and you're trying to maintain that. How does that work?
Yeah, so right now we have meal distribution sites at 43 schools. Over just a month's time frame, we have given out 105,000 meals thus far. And literally all a student has to do is go to any one of those 43. It doesn't even have to be the one that they attended. Anyone, they can go pick up a meal. We've now downsized it to doing on Monday and Wednesdays. When they go on Monday, they get meals for Monday and Tuesday. When they go on Wednesday, they get meals for Wednesday, Thursday, and Friday. And if the student can't go, the parent can go as long as they produce a report card or a school ID.
You know, I'm thinking about seniors and all the great stuff about senior year athletics, the school play, the prom, even the idea of graduating is going to be really complicated this year, depending how this plays out. What are your thoughts on that?
Yeah, I'm actually not only the CEO, but a parent of two seniors.
Really? Congratulations.
College and one graduating from high school. So it's a conversation that's had in my house almost every day. But I also have a student member of the board who's also a senior. And so we talk a lot about what that looks like. So I actually have a meeting next week with our student senior leaders to talk about what that looks like. Because what we know traditionally as graduation, I don't believe we'll be at that point for a very long time. I am committed to creating some type of structure that allows our students to walk across the stage. That may mean that it's just them present, the students, and not their parents, and we'd have to do it virtually. I don't know what that looks like, and honest and truly, we're waiting for some direction from our governors on when they think we could begin the phase-in process of getting back to some sense of what used to be some form of normalcy. I don't think we'll ever be back to where we used to be. And so we just have to work within those requirements. Honestly, they will never forget 2020. I don't think any of us will. And we're doing our very best to give them something to hold on to, some hope. And for them, graduation seems to be that one piece of hope that they all want to just try to salvage.
When this is over, no matter how hard you and all the other superintendents and school systems are working, some things will be lost. Certainly some classroom time has been lost. Is there anything else that we could be doing to mitigate that, despite how hard everybody's working, that we ought to be thinking about?
Yeah, actually, even though we just started our distance learning this week, we're already having conversations about summer learning and what that will look like, because honestly, we can't afford to have a summer learning loss. And so my team and I are working. Our goal is to have something up and for us to discuss and have a robust plan by May 15th to begin to execute and distribute to our community. And so, we were used to summer break. Summer break may look a little different for us because we've lost so much time, and even the face-to-face interaction has been lost. And as much as we're doing the very best we can with distance learning, that does not replace the human interaction that our kids are so desperately in need of right now.
Well, the kids will be just delighted to hear that their summer vacation may be in doubt too. Dr. Goldson, CEO of the Prince George's County Public Schools, thank you for your time.
Thank you for having us, and please continue to remain safe.
Now, neighbors are helping neighbors to produce much-needed face masks, as MPT's Charles Robinson reports.
On opening night, hundreds would normally flock to fill the seats at Center Stage. There's been little laughter or applause recently.
Center Stage sits on Calvert Street, but their neighbor just down the street is Mercy Hospital.
So I'm joined by Mike Ross. He's the executive director at Center Stage. Mike, let's first of all talk about this partnership you have with Mercy Hospital. How did it come about?
Oh, really special. A few weeks ago, as all this got started, the head of our costume shop, and we have one of the most incredible costume shops in the American theater by far, saw a news story about the need for surgical masks, and saw a story in Oklahoma where a hospital said basically, are there local seamstresses that could help out? So he emailed me the next morning with our director of production and said, do we have a connection to a local hospital? Is there a need for some help with surgical masks? We have a costume shop that is ready to go. And the email came back to me in all caps, yes, please. Yes, please. So our crews have been gathered all the materials. We have lots of material in our costume shop to use. They have incredible skills. They are at home. So we did a little distribution around the city to the many people that work with us in our costume shop. And they are all still today continuing to work and making surgical masks for the medical professionals at Mercy.
The hospital has since gotten the proper mask, but it echoed the need and desire to have willing partners in the community. Quote, we know the entire nation is struggling to ramp up production and distribution of personal protective equipment. We deeply appreciate the outpouring of support from the community, including Center Stage and others. In Baltimore, I'm Charles Robinson.
The Baltimore branch of the NAACP is sending a sound truck through city neighborhoods. It is urging residents to stay home to help combat the spread of the coronavirus. African American residents have been particularly hard hit, representing just over 30% of the state's population, but nearly half of the coronavirus fatalities. We spoke with Baltimore Health Commissioner Letitia DeRosa. Dr. DeRosa, thank you for being with us. Let's start with a status report of the coronavirus in Baltimore. Where do things stand?
Yeah, so thanks, Jeff, for having me. First of all, I really appreciate this opportunity to talk about where we are in the city. One of the things that we have been able to put up in the past week is a dashboard that is able to pull down data in real time. So if you go to our website, coronavirus.baltimorecity.gov, that dashboard gives you the number of cases in real time. We're also beginning to report out on race data that we receive from the state as well. So I'm referring to the dashboard because I don't want to give you the wrong number if it's updated. So I would absolutely urge people to go. But it was around a little over 1,000 cases in Baltimore City the last time I checked.
It was last week that the state started reporting the racial breakdown and the disparity data, the disproportionate number of African Americans jumps out at you. It's a large number. Mm-hmm. What do you think is driving that? What are the factors?
Yeah, so I think, COVID-19 unfortunately is highlighting some of the things that we already know about the disproportionate of health effects that chronic diseases, other diseases can have on African Americans. So we already know in a city like Baltimore, there are differences between zip codes in terms of someone's life expectancy. And so much of that is driven by what we call in public health, the social determinants of health. So someone's access to care, where they work, where they live, all of these things influence health. And we recognize that in Baltimore City, African Americans are more likely to live in poverty. They're more likely to live in food deserts. They're more likely to not have insurance or not have access to care. And that predisposes them to chronic health conditions like heart disease. They have higher rates of smoking, stroke, lung disease. So it's a combination of those social determinants of health and then recognizing that with these more severe comorbidities, they're at risk for developing a more severe disease as a result of contracting the coronavirus.
You may not have numbers on this yet, but Baltimore has a growing immigrant population. There are low-income neighborhoods that are not majority African American. Do you see any of the same factors, people, multi-generational housing, reliance on mass transit, factors like that?
Yeah, and I don't know that we have enough data yet. We are looking at that population. So we are part the city is a part of a public-private partnership with local healthcare institutions and with Care First. And we do have a special populations work group that exists within there. And the immigrant population is a part of that group. So we are beginning to look at how we can directly affect the immigrant population, to your point, that may be living in multi-generational households. And it may be challenging for someone who's been ill to go back home to their family.
There's also the rumor control issue. We mentioned the NAACP outreach. What do you want people to know? What do they maybe think they know that you want them to know the truth about?
Yeah, so some of the rumors and myths that I've heard is that African Americans think that they can't get COVID-19 and it's not a disease that we're contracting. And I would firmly dispel that rumor or that myth, that everyone is susceptible. And again, as in our case, if there are underlying health issues, that you're even more susceptible to some of the severe complications from COVID-19. So everyone should take the personal protective measures. Everyone should be doing social distancing. Another kind of rumor that I've heard is, some people are confused about the stay-at-home order, and they maybe think it's related to a curfew. And really, it's staying at home unless you have to go out for an essential reason. So it has nothing to do with the time of day or the time of night. We really do want people at home unless they have to go out for an essential reason.
In addition to the stay-at-home order, people are now required to wear masks if they're going into a store or that sort of thing. But where do you get the mask? I mean, I guess if you can sew, you're maybe in good shape here. You have any advice for people? Is there anything the city government, the state government can do to help with this?
So I would recommend the use of a cloth covering if you have to go out. And it doesn't have to be anything formal. We actually are not recommending the use of surgical mask or medical mask for the lay person, because we really do want to reserve that for our healthcare workers. But there are a lot of videos on YouTube about how you can create your own mask with a bandana. I actually did that myself. So I would refer people to that. You can use an old t-shirt. So it doesn't have to be, a formal surgical mask. We really actually want it to be more of a cloth covering with an old, home item that you have.
How's your team at the health department holding up? I mean, you're busy with normal business, and then this comes along, and there's an expectation that you're going to be able to do contact tracing on thousands of people while taking care of the city and your own team members.
Yeah. So I have to actually really take a minute and commend my team. Within the health department, we house an Office of Public Health Preparedness and Response and an Office of Acute Communicable Diseases. And weeks after really that first case was identified back in January, we actually instituted our incident command structure, again, relying very heavily on those two divisions to begin thinking through preparedness and what it might look like if we began to see cases in the United States. So we started that in January. And then subsequently, we already had a lot of that structure in place when we began to see the cases develop in the United States, and we were already beginning to plan. So I have to commend my team because early on, we really kind of kicked into action and kind of preparation mode. Our Office of Acute Communicable Diseases really is the branch that focuses on the contact investigation. And again, I think they've done a very good job. We've brought in additional staff from our school nursing support. We're working with an academic partner to train people to help with the contact investigation piece, because we recognize just how important it is.
I don't know if this is run by the state or your office, but the testing sites in the city, what should people know about how that works right now and the availability of tests overall?
Yeah, so we actually support a testing site at Pimlico in partnership with LifeBridge, the Stronach Group, and the Maryland National Guard. So that is the only technically city-run testing site, though there are others at some of our local hospitals and some of our urgent care centers. So what I would say is that there is still very much a need to get a referral from a physician prior to getting tested. So there should be a clinician who is screening for symptoms and trying to determine if you're in that high-risk group. Because of the limited access to testing, we still want to prioritize who receives testing. And really the top priorities are hospitalized patients who are symptomatic, healthcare workers that are symptomatic, first responders that are symptomatic, adults over the age of 65 that are symptomatic, those with underlying comorbidities that are symptomatic, and those also living in congregate living facilities that are symptomatic. So again, the testing really is focused on those within this high-risk group that are showing symptoms, and there's referral for a physician in order to be able to get the testing.
Very good. Dr. Leticia Duraza is the Health Commissioner for Baltimore City. Thank you for your time.
Thank you.
Now, stay-at-home directives have affected the spring real estate selling season, as Nancy Yamada tells us.
Real estate agent Juanita Matthews of eXp Realty joins us. Juanita, I know usually springtime is your busiest time of year. What are things looking like right now amidst the pandemic?
Well, typically, like you mentioned, it's definitely a good time to start looking for a home and putting a house on the market. But right now, it's a little different. There has definitely been more of a shift than was anticipated around this time due to what's happening right now. So yes, it's definitely lower.
Have you had clients who've pulled their homes off the market? And do you still have people contacting you saying they want to look at a house?
Good question. My sellers that I have on my list in terms of being able to put them on the market soon have kind of pushed away from doing that right now. But I have a lot of buyers out here right now that are taking advantage of the low interest rates, as well as the opportunity to buy something at a good price.
So I know that open houses are banned right now, correct? Like you can't conduct an open house, but how are you showing homes? I know that real estate agents have to get creative.
Yes, a good question too. So number one, there's a couple of times with particularly builders and some other homes that have the 360 videos as well as full-blown virtual tours. I'm able to show homes that way, but then I'm also still able to show homes as long as I'm very cautious about that. Make sure I wear my mask and have my gloves, and everybody else has to have theirs as well. Can't have more than 3 of us in a house at one time. And keep the social distancing as well. So I am showing homes traditionally as well as virtually.
Are closings delayed?
Yes, as a matter of fact, I have a couple of closings that were delayed, but I just recently had a closing that was not delayed. It was just a little different. We did it through Zoom, which was really convenient. The buyer was at his sister's house. I was at my home office. And then, of course, the settlement officer had to show up. But again, with obviously his gloves and mask and so on. So yes.
We obviously don't know what the future holds for any of the industries, including the real estate industry. But earlier, when we were speaking off camera, you mentioned that you foresee a lot of homes being sold in the future.
Yes, I do. And part of the reason, and some of this may not be like happy reasons, but there's going to be a lot more people that are going to be downsizing, or as I call it, right sizing at this point, because sometimes people have homes that they really, they're paying a high mortgage, and now, one of them lost their job. Well, now we would have to downsize. And then you've got people that, just generally want to be more of a minimalist as well. You've got foreclosures that have been put off, but they'd like to get their house sold before it even gets to the process of being foreclosed on. And then you've got the divorce rate may or may not go up. And that may be part of it as well, just because there's just so many financial changes going on in the family.
And now little bits of painted beauty for troubled times. Here's MPT's Sue Copen.
It's not unusual for Annapolis resident Julie Heath to take a walk in this Anne Arundel County park. But these days, when she hits the trail, she sometimes will leave a little something behind for others.
I just wanted to share a little bits of joy for all the people who've been out walking all around the Annapolis area. And creating art is the perfect way for me to share joy.
Heath says becoming an artist has helped her through some difficult times. But rather than her usual work on canvas, she recently started painting these rocks, creating art for others to help them through this difficult time.
It was healing for me, so I thought perhaps it'd be healing for others if I could just share, like I call them, little pops of joy out there in the real world.
Heath creates her special rocks in this small studio in the basement of her home.
It's painting, it's paper, it's outdoor glue to make them secure, it's sparkles, it's everything. It's, again, the simple rule for me is to make someone happy when they find it and take it home.
One of the lucky ones is Heath's neighbor, Martha Janney.
I was walking the dog and I came home and there was this beautiful little butterfly. I don't know if you can see it, under my mailbox. And on the back, it says, what does it say? Peace rocks?
Peace rocks.
Yes, double entendre there, but it just made me happy.
Heath says she has just a few special designs for her rocks.
Butterflies, because I feel like that's kind of a rebirth. And the other ones are birds, flight. You know, I want freedom to these little pieces of art to evoke some sense of freedom. And then, of course, the ubiquitous hearts, which is just sharing love with people.
So if you find yourself on a path in the Annapolis area, be sure to look down. You just might find a little bit of peace in front of you. In Annapolis, Sue Copen for MPT News.
Thanks, Sue. And remember, the best source of official information on the COVID-19 outbreak is coronavirus.maryland.gov. Coming up Monday on Direct Connection, how the coronavirus can damage the heart. If you have a question for a University of Maryland Medical System cardiologist, you can email it to us right now. The email address, livequestions@mpt.org. Now for Sue and Nancy and Charles and all of us at MPT, I'm Jeff Salkin. Thanks for watching and have a good night.
This program was made by MPT to serve all of our diverse communities.
Programs on MPT are made possible by our members and the following.
Founded in 1992, Van Sant Mushaw, a fee-only registered investment advisor, providing wealth management and investment solutions for individuals, family trusts, nonprofits, and qualified retirement plans.
Sun Nurseries, featuring locally grown annuals, perennials, fruiting plants, trees, and more. Sun Nurseries also offers landscape design and installation. Family owned in Howard County. More at sunnurseries.com.
The Maryland Department of Veterans Affairs is focused on minimizing the impact of the current health crisis. Although we may be working from home, all of us at MDVA remain committed to serving Maryland, our veterans, and their families. Learn more at veterans.maryland.gov. Some things are inevitable. Diabetes doesn't have to be. 84 million American adults are living with prediabetes, and 90% of them don't know it. To learn your risk, take the American Diabetes Association Type 2 Risk Test.
Celebrate the finest classical and inspirational harmonies and